Hi, good morning Don. My name is Emetez. I'm your invigilator for the OET speaking session on the 14th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Don Lucas.
And what is your candidate number, please?
My candidate number is 250140003.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Describe your profession.
My profession is nursing. Nursing is a profession within the healthcare sector, focused on the care of individuals, families, and communities, so they may attain, maintain, or recover optimal health and quality of life. From other healthcare providers, nurses differ by their approach to patient care, training, and scope of practice. Also, the nurses comprise the largest component of most healthcare environments.
So far, what did you achieve with your nursing career?
I choose nursing because of my passion towards it. My nursing career started when I joined my college for a nursing degree. From there, till now, successfully completing 3 years as a nurse, every step can be considered as my achievements. However, the experience that I have gained so far is my greatest achievement, if it has to be mentioned. And it will be the strongest asset for my future growth.
How would you handle a patient who doesn't have health care insurance?
It is determined if the patient needs to be treated. Then, we try to have our accounting department or finance department work with the patient and the carers on their needs. If it is an emergency, regardless of all these, we should still treat the patient immediately. It is our responsibility and professional ethics. Hence, we are directed to do so.
Tell me your feelings about being a nurse.
Being a nurse, every day challenges my critical thinking skills. And there is never a boring day at work. I have the pleasure of meeting people with diverse backgrounds from all walks of life. Definitely, I know I'm making a difference. As a nurse, I'm always learning something new. Yes, I feel proud and satisfied being a nurse.
Will you recommend nursing to the young ones?
Definitely, I will. I know the benefits and struggles one may come across in the nursing career. The nursing profession is an unmatchable one, and demands skills and mindset. Also, the nurses are short globally, and have a high chance of getting placed soon. Most of the countries offer decent wages as well. I will surely educate the young ones about the opportunity they have in the nursing career, and also make them understand the importance of the nursing job, and the difference a nurse is making in the lives of everyone.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Don Lucas. I will be your attending nurse here at the clinic today. How may I address you?
Good morning, nurse. My name is Emma, Tez, and you can call me Emma.
Hi Emma, nice to meet you. How may I help you today?
Well, nurse, I am here for my son. He had an accident while cycling and injured his forehead.
I am sorry to hear that. Before proceeding further, may I know his name and the age, for the record please?
His full name is Hugo Luke, and he is 8 years old.
Thank you Emma. For better understanding, could you please explain to me in detail what happened to Hugo?
Sure, nurse. He was riding his new bicycle on our home premises. On one lap, he lost control and fell from the bicycle. His head hits the gate post.
All right.
Nurse, he was unconscious for 15 seconds, and that feared me a lot.
I acknowledge your situation, Emma. Try not to worry, your son is in our safe hands.
Yes, I admire that.
Also, may I know when this happened?
It happened an hour ago.
Okay. And did you notice any other injuries to him?
I did a thorough check, and he is perfectly okay, except for the forehead.
All right, Emma. So, let me examine Hugo, please.
Sure, you may, nurse.
Thank you for allowing me to examine your son. And from my examination, he looks very pale and lethargic.
Yes, nurse.
And from your words, he was unconscious for 15 seconds. Which is diagnosed to be a mild concussion.
Oh, okay.
Nothing to be panic about at the moment. Since he is not bleeding, it indicates no fracture for his head.
All right.
However, a large bump came upon his forehead, which will be quite painful for a while, and will take several days to disappear.
Okay, nurse, I understand that.
Emma, Hugo requires your observation for the next 24 hours. Also, ensure that he is getting adequate rest. Try to make Hugo stay indoors as well.
Okay, nurse. I will take care of him.
May I know if you have any other concerns to be addressed by me?
Yes, nurse. Dual CT scan necessary for Hugo, on the stage.
I appreciate your thoughts, Emma. Actually, a CT scan is really not necessary in Hugo's condition. It is because he is having only a minor head injury. As I said earlier, no bleeding is found, eliminating the possibility of a fracture. Normally in cases with a mild concussion, a CT scan will be probably not helpful, and show normal results. I hope I am clear to you.
Yes, nurse. It is clear to me.
That's great. And Emma, I would like to suggest that you make sure Hugo wears a helmet while riding the bicycle in the future.
Yes, nurse, I will.
It is important for the children to wear a helmet while cycling, which will avoid head injury. A helmet can eliminate both minor injuries like bruising, headache, etc., to those resulting in loss of memory or disability as a result of major head injuries.
I totally understand the benefits of wearing a helmet. I will definitely take care of it, nurse.
Glad to hear that, Emma. I would also recommend you encourage Hugo and make him comfortable so that the child should take it easy, thereby helping Hugo to get a better recovery.
Yes, nurse, you are correct.
On the other hand, Hugo may be having the fear of cycling. So, your care and encouragement are essential in overcoming that fear and helping him to become active.
Definitely, nurse. I will take care of him. That is so kind of you.
I am glad I was able to help you in this situation. Emma, I would like to inform you about certain symptoms that you should be cautious about during the 24 hours observation. Please pay attention to me.
Sure, nurse. You may please proceed.
Emma, contact the doctor immediately if Hugo's headache persists even after 24 hours. Also, seek medical help if he feels nauseous, dizzy, etc. Please pay attention to his pupils and check if they are dilated. If yes, it is an emergency. I hope you understand that.
Yes, nurse, I understand that.
Emma, feel free to contact us in case of further queries.
Sure, nurse.
I wish your son a speedy recovery.
Thank you. That is the end of your OHE speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.